Hello and welcome to this introductory session for the Assistant Practitioner. I can't get it right. There we go. It's there. My name is Steve Davis. I'm the mental health nurse and I'm going to be your tutor for this program. Now, it's important to say there's two elements to this program. There's an on-program requirement, and that's called the Assistant Practitioner Diploma, Level 5. And then there's the standard. So you may be doing the diploma or you may be working towards the standards. But to be fair, they come together as two as the same. So the knowledge isn't lost on either side of the fence. It's going to be the same thing. The only difference is if you're doing the diploma, you don't have the endpoint assessment. However, through the diploma, you're doing the endpoint assessment anyway. The observations, the professional discussions, and the reflective writings. So actually, it's two of the same. But we'll run through it so it's very clear. So what we're going to do is I'll share my screen shortly and we'll explain how the program comes together, what it is you need to do, and how you're going to prepare for that endpoint assessment. So first of all, this is for the people that are doing the standard as the assistant practitioner. And then we'll talk about the diploma a bit after that. So you should be in a level 5 role. You should be working with some level of autonomy. You should be assessing patients' care needs, and you should be doing an array of clinical skills. Now, this word seems to strike a chord with some people. Clinical skills aren't just things such as catheterization, venipuncture. It's an array of things. It could be monitoring ECGs. It could be taking vital signs. It could be medication. It could be care plan. It could be assisted moving and handling. They're all clinical skills. So we're doing them, we're just not calling it that in health and social care. We get very tetchy about saying clinical skills because we think we need to be a nurse. In fact, if you look at the level 3 healthcare practitioner qualifications, you will notice that a lot of the skills that we teach in this are actually taught at level 3 in hospitals. Venipuncture, catheterization, all of that stuff is a level 3 healthcare skill. It's just the fact that nurses have upskilled ourselves. So we've all moved up a level. The problem is health and social care needs to move with that move. And I appreciate that there are rules and regulations. So if you're in a residential home, it is unlikely that you're down for treatment of disease and disorder. So therefore, your clinical skills are going to be limited to those that are working in a nursing home, or indeed if you're in a domiciliary setting. It doesn't mean that you can't do it. It just means we need to look at different ways to provide new opportunities. And then I get asked a lot, well, once I've learned the skills, who's going to be responsible for them? How do I maintain them? Very simple answer. You are. So when I became a nurse, we are responsible in our own right to maintain our clinical skills. That's the whole point of revalidation. The whole point from your care certificate, if you go back to when you did your induction to your level 2s and your level 3s, every single qualification that you have done, there is a unit that says manage yourself or personal professional development. And that's because it is down to you to measure your levels of competencies and decide whether or not you feel you're safe to do the role. And if you're not, it's down to you to then go and find updates and CPDs to revalidate yourself to make sure that you are safe and competent. Nobody is asking you to perform a role that you are not trained or competent in. And it's important that you understand the competency frameworks for each skill. So we're just holding that out there. That's my massive disclaimer. So we're not licensing you to deal with insulin and diabetes if that's not part of your normal working role and you've not been assessed as competent to do so. Just bear that in mind. So let's just have a look at what you need to learn. So we have our skills, knowledge and behaviours. For this one, they had to give values as well. Again, it's stuff I expect you to be doing all of the time. Honest, caring, compassionate, committed, conscientious, treating people with dignity, respect, being adaptable and discretion. So you should be doing this all of the time. This shouldn't just be a one-off. We then have our knowledge and our skills. So the knowledge is the same knowledge on the standards as it is in the diploma. So you're not going to double up on this. It's the same. Okay, so that's really important. And in your diploma, you will cover this with me via a professional discussion, and I'll show you where the learning materials are for this. But here, understand principles and philosophies of healthcare. So that's unit 1. Understand the functions of the human body. So that's your anatomy and physiology. Understand lifespan development. So again, that's in there as a unit. You've got your research, which is APH 20. Providing holistic person-centered care. Can't remember the numbers off the top of my head, but that's there. Working within a strategic environment and evidence-based practice. So your knowledge isn't that vast in regards to how much we need to get into you to pass this. But I'm not undermining it, because actually there is a lot of knowledge there. But normally when we look at these, there's normally about 25 or 30. So here we've got some condensed learning that has to happen. And what we've done in your portfolios, in your login areas, I've created a video for each of these. You watch those videos and then you have your professional discussion. Once you've had your professional discussion, we sign you off and then you should be good to go. And again, for the skills, nothing too technical here in the skills. You've got your roles and responsibilities given, is what we've just talked about. Case management, so you have to identify 4 people. So there, looking at what we've been saying to people, it's from crib to grave. So we're looking at the lifespan there. Or equally, we're looking at 4 admissions to discharges. So showing me that continual cycle. You need to supervise and teach. So when you log in your very beginning, you're asked to go to the Higher Education England's website. As part of that, you do your Care Certificate Assessors Award. Everyone goes, I've got the Care Certificate. No, it's the assessors to be able to sign off the competencies for that. Personal development. So again, going back to what we talked about, preparing your personal development plans, understand what they look like, supervisions and appraisals. Working within teams, so that's your team leadership. Assessments, so module 1, when you go through your CHAPS program, which is your bolt-on module, the CHAPS program, we cover all of the assessment stuff. Communication, we cover all your communication stuff. We cover theories around Shannon and Weaver, etc. And again, teamwork, and we cover Tuckman. Personal centered care, again, it's covered through your CHAPS program. In there, you're going to be looking at strength-based approach, outcome approach, STAR approach, focus approach. It's all in there. Undertake physiological measurements. You will do this. You will do this as part of your OSCE, so your observations. So when I come out to see you, we do 3 skills days. So we just observe, you practice, observe, you practice. And then when you're competent, we sign you off. Risk management, so infection control, health and safety, and risk, and positive risk taking, equality and diversity, so inclusion, and then quality improvement cycles. So again, from a skills point, it's a lovely skill set, nothing too technical there. In the diploma, it becomes a bit more technical, so we'll cover that shortly. But for the standards, that's what you're looking at. And then finally here, once you've completed that level of learning and you're competent, confident that you're competent, we need to then put your evidence together for you to go through a process called Gateway. So that's your English and Maths at level 2, your care certificate that you should have had prior to starting the apprenticeship, not the assessor's award, but the actual care certificate, your level 5 diploma, which is your assistant practitioner, that's this one, that's the one awarded with NCFE cash, and that you're working in line with codes of conduct of health and social care. Okay, if we then go up to the assessment plan, this is what you're going to be assessed at. So you will have a multiple choice short answer test, and normally towards the back of these, you'll have a breakdown so you can see what's going to be covered in the exam. You're going to be observed in practice, working within your workplace, so you'll agree that with the EPA, and then you complete a reflective journal for an interview. So you can see here you've got your flow charts. you've registered, you've done your care certificate, you've done your English maths, and you've worked towards your diploma. You go through Gateway, you have your test, your multiple choice test, you then have your observation, your reflective journals, and then you're graded. So here you can see what's being covered through the multiple choice exam. So this is the knowledge, principles and philosophies of healthcare, anatomy and physiology, lifespan development, research, promotion of holistic personal-centered care, and the importance of evidence-based practice. In the observation, again, you normally agree this observation with your EPAO, but you're going to be managing an episode of care. So that episode of care is going to be down to you to plan, making sure that you've got consent and it's safe to do so, etc. But here you'll be assessed communicating, managing information, infection control, maintaining the right ways of working, and demonstrate those values, treating people with respect, showing empathy, providing leadership, and define clinical therapeutic interventions. So whatever it is you've done, so let's say, for example, you've decided to do vital signs on somebody, you do the vital signs, you score it up, you're going to come up with a recommendation, so a SABAR, so situation assessment background recommendation. So again, it may be off a news or muse score where you go, look, this patient scored 3 in line with our company policy. We now need to phone a doctor, make a transfer to ambulance, or carry out the observations again. Depends what your policy is for those muse scores. For the reflective journals and the interviews, so 3 months leading up to your EPAO, you're going to keep a journal based on case management and supervision. So at this point, you need to keep a journal on those 2 points. And if we go further down, it will explain what those points are. So that's your observation of practice. So there's your journals there. So the apprentice will write a written account, 2,000 words, plus or minus 10%, around case management and how you've allocated work in supervision and training. That interview will normally be about 30 minutes or between 30 and 60 minutes. So they're just going to question you on what you write. And ideally, in your case management, you'll be able to think of those 4 people that you've worked with. You'll be able to list what you did, how you did it, why you did it. And for supervision and training, you should be able to talk about the care certificate and then your trainer. So anything that you've bolted on there. And then ultimately, what then happens is that comes together and each of those are scored. The observation is a pass or a fail, so you can only pass or fail that. The short written questions is a pass, merit, or a distinction. So depending on what you've got there. But again, if you've done the CHAPS program, the Care Home Assistant Practitioner module, you will be so used to multiple choice tests because you have to do one after every single piece of work, and then that reflective journal and interviews. So again, nothing too terrible to trip you up, so nothing to worry about there. Okay, so let's look at what it looks like when you log in. So you're going to log in, and basically here, as you log in, you've got your welcome to your program, you click through that. Here is your research project that you upload. So again, when you click on there, it's just this one, so you know where to upload it. I will be adding 2 more buttons on there, and I'll explain this in a second. But this is where we upload the evidence for your diploma. So for your diploma, you will do a 2,000 word research project, plus or minus 10%. You will have a minimum of 3 observations from me. And you'll know what they are because it's under the assessment tools here. You will have your short written answers, your professional discussion, and your research. So you've got those pieces of evidence. So they're uploaded there. And then all you're going to do is you're just going to go through these. Now, to prepare for the professional discussion, I've done a video. And if you look at the assessment tools here, there is your assessment tool there for the professional discussion. So this isn't a shock. It shouldn't be a surprise. I've given you what it is we're going to be looking at and what we're going to be talking about. Now, it's very clear when you haven't watched these videos, because ultimately I'm going to ask you about principles and philosophies of healthcare. And in Unit 1, we cover a very specific range of things, such as we look at ethics, we look at innovation, we look at technology. And if you haven't watched that video, you're going to struggle in answering those questions. So please make sure you have watched the videos before you have the professional discussions. Now, you may go, well, there seems quite a lot there. Where does this all come from? Well, when you log in to your course materials, you will see, let's have a look. Oh, it's on to pre-reading. I think it's on the pre-reading. Oh no, sorry, it's under program information. Make sure I give you the right one. And it's the program specifications. So let's just click through this so you can see what it is. So again, video, just watch the video. That's your learner handbook. That's your observation assessment pad. Right, here it is. Here's the qualification specification. So here we outline, this is where we get the material from for your diploma. So if you scroll down on here, and again, I know the people that have done this because it makes sense to them when we have the conversation. There we go. Principles and philosophies of healthcare. The first unit that you cover here is we've got to cover understanding the purpose of healthcare provision, understanding the impact of strategic drivers, and here it gives you a breakdown. So 1.1, functions of healthcare provision. So I'm going to ask you, I'm going to say to you, what are the functions of healthcare provision? And hopefully you're going to come back and you're going to say something smart like, well, Steve, it's designed to promote the health and well-being of individuals. And ultimately, we have to provide high-quality, cost-effective care because that's what we need to be doing to making sure we're safe, effective, etc. Now, you can see the answers are there. It gives you the answers. And ultimately, that's what we need to cover. When we scroll down, we've then got the logbook. So this is the evidence requirement. So here you can see it says, what I'm going to ask you is I'm going to say to you, can you explain to me 2 functions of healthcare provision? If you have watched this, you will see that there, but there's the answer. So this isn't a shock. This is exactly what you need to be doing. So if you haven't watched this, it's very clear that you don't know what you're talking about. So please don't try and blag me because it's obvious that you haven't done the work. So please make sure that you log in and make sure that you watch those videos because I've spent a lot of time making the videos for you to understand how to answer those professional discussions. And if you can't answer it, I can't pass you. Now, we do try and give you as much help as we can to get you through it. But the idea of the professional discussion is to prepare you for that endpoint interview. So again, the observations that we do with you prepares you for the observation. The professional discussion we do with you prepares you for that EPA. So it all links together. So really, all your role here is to work through this and to keep up to date. Go through these modules and then you'll be ready. Now, at the bottom, what I've done further to cover the skills, knowledge and behaviours as a final recap, I've added PowerPoint presentations for all of those skills, knowledge and behaviours in which you need to cover. So this is like a super recap. So just before your EPA, run through that and make sure you've got yourself up to date. Anyway, I hope you found that useful. I hope that's given you a very clear expectations of what's required. And if you need any further assistance, don't hesitate to drop me a message or a WhatsApp. Anyway, I wish you all the best of luck. Take care.